Good morning and welcome to Advocate Live. I'm your host, Stephanie Johnson. Today we are taking your questions live with Interventional Neuroradiologist Dr. Thomas Grobelny, who practices at Advocate Lutheran General Hospital in Park Ridge, as well as Advocate Christ Medical Center in Oak Lawn. If you are watching us on Facebook, you can post a question right now by clicking the share button. If you're checking us out on Advocate Healthcare's webpage, just click submit a question. Dr. Grobelny, thanks so much for joining us today.
Thank you for having me.
All right, so we know May is National Stroke Awareness Month, so a lot of information about stroke out there, new technology, and we're excited to have you here with us today to share your expertise about stroke, stroke prevention, brain aneurysms, and the latest leading technology. So thank you.
Thank you very much.
So one of the top questions before we get started taking viewer questions will likely be, and it's at the top of my mind when we first met, what exactly does an interventional neuroradiologist do?
Well, that's actually a very good question. Interventional neuroradiology is a very new field of medicine that evolved with the technology, with digital technology, computer technology over the past 10 and 20 years. And what simply I say to many of my patients, I'm a cardiologist of the brain. So cardiologists have been doing a coronary angioplasty and stenting for many years before we wandered all the way up into the brain vessels. So I think that's the simplest answer I can give you.
All right, heart care for the mind. I love it. All right, so we will get started with taking viewer questions now, and a lot of them have come in as we've prepared for this live show. So without further ado, first question from Angela, who sent in a question on Advocate's webpage. What exactly causes a stroke?
Well, I would start with talking about stroke. There are two categories of stroke. There's ischemic stroke caused by blocked vessels in the brain, and there's a hemorrhagic category caused by a brain aneurysm. It's a hemorrhage into the brain. So in a ischemic category, obviously, if we have an atrial fibrillation or some clotting problems in the body, that clot will wander into the brain, block the vessel, and you cannot move one side of the body. You have a stroke. If you have an aneurysm that ruptures, you have the worst headache of your life, and you also having a stroke at the same time.
Okay, so definite difference between the two. Okay, so is it possible, and this is a good question from Betsy, is it possible to detect a stroke before it actually occurs?
Well, I think it's really impossible if we're talking about the different time frames. So like within minutes or hours before it happens, I don't think it's really possible. But if you aware that you have a family history of brain aneurysm, if you're aware you have a family history of stroke, and you seek medical attention and go regularly to your doctor that can do certain tests to find out that there are any structural problems that may potentially lead to a stroke.
Okay, so it's important to make sure you stay on top of your checkups, to make sure you know if you have any conditions that put you at a higher risk for developing stroke.
That's correct.
All right, so let's move on to another question that came in from Linda. Are strokes more common in older individuals?
Yes, it's true, because if we're talking about adult populations, we're talking about stroke. Stroke is a phenomenon that's related to aging blood vessels, to atherosclerosis. Also, heart conditions with failing heart, atrial fibrillations, is a more common problem in the older population. So that's true. As we age, the risk of stroke is higher, but stroke happens in younger people too.
All right, so what about children? Let's expound on that. So are kids now more susceptible to getting a stroke than in past?
Well, I wouldn't say more susceptible now. Maybe we're more successful diagnosing stroke in children.
Got it.
But we cannot forget, children are also at risk of having a stroke.
Okay, so can you talk to us about the risk factors then? Tell us what exactly what should we look for when it comes to stroke?
Well, it's kind of interesting because we already went into that adulthood and children. So I would say let's start with children's.
Okay.
Actually, we know that certain diseases in children's make them more susceptible to having a stroke, like sickle cell disease, or having congenital heart problems. In adult populations, if you have a high blood pressure, hypertension, diabetes, if you have increased cholesterol level, that will eventually lead to accelerated hardening of blood vessels and blockages, those are the risk factors for having a stroke.
Okay, and a question just came in live from Rebecca, which I think is very a good one, just expounding on your point. Her mom suffered a stroke, a rather serious one, and was found to have 7 aneurysms of the brain. Does this put Rebecca at risk? Should she be seeking help or additional treatment because her mom had a stroke?
That's actually a very good question about brain aneurysms.
Mm-hmm.
And we usually say that more than 90% of aneurysms are spontaneous. So one family member has an aneurysm, and it does not run in a family.
Okay.
However, if you have a next to kin that had a brain aneurysm, then you fall into that 5–10% of aneurysm running in the family. Then we strongly advise for children and next to kin to be evaluated with minimally invasive studies to check for possible brain aneurysms.
Very good information. And another question that kind of stays in that same vein came in from Catherine on Facebook, and she wants to know, are there certain races and ethnicities that are more vulnerable when it comes to stroke?
Well, yes, and that's a very good question. Like African American population is more vulnerable to have a stroke because of higher prevalence of high cholesterol, hypertension, primarily. So yes, there are certain, and like in children, sickle cell is also in African American population. So those ethnicity races are more likely to have a stroke.
So if you know, me, I'm an African American, so that really hits home for me. Is there something then you would tell me that I need to be doing to make sure I'm okay? Would you just recommend that I watch my health, watch my diet, not smoke? Are there certain things that a person can do when they already know they're in a population that's at higher risk to have a healthy lifestyle?
Well, I think the best answer to your question is, yeah, you are the population of higher risk for that certain disease, hypertension. So if you have a hypertension or diabetes, you have to be careful.
Got it.
But everything else, it just applies to all of us, you know, like smoking. Obviously, if we smoke, smoking increases the chances of developing a hardening of blood vessels, and that leads to stroke. So healthy diets, yes, it's all about that cholesterol. Exercise, yes, it's all about keeping our body happy, our arteries healthy for as long as we can.
Okay, I will take that and I will do it. So another good question just came in, great one from Julie live. What treatments are effective in the moments immediately after a stroke occurs?
So again, if we look into this category of the ischemic stroke, if we have an ischemic stroke, you have to immediately call 911, or somebody witnessing the stroke has to call 911, and you have to be brought to the emergency room and then be diagnosed and be seen by ER staff and neurologists. And in the first line of treatment, FDA-approved treatment is intravenous thrombolytic therapy, IV TPA.
Okay, wow, that sounds, what does that mean?
It means that, you know, if you have a stroke, time is brain. We always say time is brain. So faster you get to the hospital, faster you get diagnosed with having a stroke, and faster you receive a treatment, you have a higher chance for recovery.
Okay, that sounds very good information, Dr. Grobelny. Another question from Kate that came in on our website. I've heard that arteriosclerosis can lead to stroke. Is that true? And what exactly is that?
Well, actually, we partially kind of answered that question already. The arteriosclerosis as a hardening of the blood vessels and causes leading to it. So bad cholesterol that everyone knows about, smoking, and unhealthy diets. But bad cholesterol runs in the family. So that's that familiar factor that comes into. And usually atherosclerosis develops in older ages. But when you have those increased risk factors with hypertension, the atherosclerosis can even be seen as early as in your 40s.
So just for clarity, there is a link there.
Yes, there is a direct link.
There is a direct link. Okay, what about this? You just touched on this just briefly about what you should do when Julie's questions in the moments right after someone experiences a stroke. Is there something that you can do like CPR? Does anything like that a lay person can do for a person who's suffering a stroke? Are there steps they can take to help until paramedics arrive?
Well, it all depends what's the presentation of the stroke.
Got it.
and if the person witnessing the stroke can actually assess the vital signs of that person.
Got it.
Usually the stroke, when a stroke happens, you have numbness, you have weakness, you have speech problem, you have visual problem, but your heart rate is maintained. But obviously, if you stop breathing and you have a hemorrhagic stroke, and you're unresponsive, if the person witnessing is qualified to administer TPR and CPR and assess that patient, yes.
Okay, so there's much more you can do if you're clinical, have some clinical experience like a nurse or a physician, than if you're just a regular layperson.
That's correct.
All right, so I have another great question that came in from Heidi on Facebook, who wants to know what kinds of scans or image testing is available to diagnose strokes.
Well, we have a wide variety of imaging right now to diagnose stroke. I think the most commonly used and always first available in the emergency room is a simple CAT scan, CT of the brain.
Okay.
And that CAT scan will tell us if there's a stroke, how old is the stroke, is it a hemorrhage, will differentiate us actually ischemic stroke from hemorrhagic stroke. And then we have more advanced studies like CT angiogram, MRI, MRA, all the way down to cerebroangiograms.
Okay, so just building off that with a question from Marcia, then what kind of surgeries are available when it comes to treating a stroke?
Well, again, I'm staying with that, distinguishing the ischemic and the hemorrhagic.
Got it.
So when we have the ischemic stroke, we have 4.5 hours for neurology team to administer intravenous thrombolytic therapy, the TPA.
Mm-hmm.
But we know that if we can diagnose that that patient has a large vessel occlusion, occlusion of the carotid, occlusion of the MCA, then the interventional neuroradiologist is called on the scene, and we can do procedures, so-called thrombectomy procedures, so angioplasty and stenting, trying to revascularize and open those blocked vessels.
You just brought up a word that someone wants to know what it means. Ron says, what exactly is a thrombectomy? He's heard that when it came to his mom and wants to know, what does it mean?
Well, thrombectomy is just removal of blood clot from the vessel.
Got it.
And you can do thrombectomy in your arm, in your leg, but my specialty do thrombectomy in the brain.
Okay, wow. So this is a really great information, Dr. Grobelny. And Victor and Cynthia asked two questions that are kind of along the same lines. They want to know, how does a stroke, or how can it affect your personality? Is depression common? Can you see a complete change in your loved one after they've had a stroke?
Well, a stroke, and it depends on the size of the stroke. We have minor stroke and major strokes.
Okay.
And I'm not really a specialist in that arena, but if you come out of the stroke affected and you cannot move your arm or your leg, that affects your life. You cannot return to work.
Okay.
You cannot go back to where you were before. I think the cause of depression, there's a big cause of depression, being depressed.
All right, Dr. Grobelny, you are doing a fantastic job. I'm going to do just a quick pulse check with the audience who are just joining us. So if you're just joining us, we are taking your questions live about stroke, brain aneurysm, stroke prevention with interventional neuroradiologist, Dr. Thomas Grobelny. So if you're watching us on Facebook, you can post a question by clicking the share button. If you're checking us out on Advocate Healthcare's webpage, just click submit a question. So back to it now, Dr. Grobelny. Mark wants to know that he's heard if you get therapy immediately following a stroke, there's a better chance of recovery. But we've seen cases like in Senator Kirk's case where there's a long road to recovery, and then some people who make a full recovery. Can you expound a little bit on what's the difference when someone can bounce back more immediately, if you will, than someone else?
I think, this is a very good question, but there's no true simple answer, because we have strokes that are minor stroke and large strokes. Okay. And I think we can talk for hours about possibilities and likelihoods and how can we predict. But just to answer it for our audience right now, if it all depends. If you have a large vessel occlusion, and we're talking about what I treat, carotid blockage or MCA blockage, it's all dependent on collateral flow.
Got it.
So if you have a penumbra, if that brain that is ischemic and non-functioning at that time before the intervention still can survive, and when I can reopen the vessel or IVTPA can reopen, will that brain bounce back? And we never know.
Okay.
We open blood vessels, and then we have to wait days, sometimes weeks, with the rehabilitation, how this patient is going to eventually do.
Okay, so then that leads right into Emily's question, who wants to know, well, if you've had a stroke, should your doctor then schedule MRIs on an annual basis to just watch?
Well, if you have a stroke, then the stroke goes through certain progression. You know,
Okay.
initially within the first 24, 48 hours for large strokes, there's a lot of swelling. Then the swelling goes away and you have a scar tissue. You really don't have to watch the scar tissue, but if you had an underlying problem for the stroke, you have some narrowing and blockage that you have to watch. Let's say you had a brain aneurysm that was treated with coiling, and sometimes we do MRAs, follow-ups on those patients for many years.
Yeah.
If you had multiple aneurysms and we treated some of them and some that we don't treat because they are too small, you have to watch these things throughout the life of that patient.
Okay, so good information to have. So what medication are often prescribed after a person has had a stroke?
Again, medication all depends, you know, what is the reason of the stroke. For ischemic stroke, the statins statins are frequently prescribed by neurology. The aspirin, Plavix. If the cause of the stroke is atrial fibrillation, you are more likely to be placed on blood thinners like Coumadin.
Right.
Many patients with brain aneurysm that we treat, we place them on also antiplatelet medications. Just depends what we do in the treatment.
Okay, let's get on to something that's right up your alley. What are some of the latest leading edge treatments out there available to treat stroke?
And see, my face is smiling already. Yes, because I've been blessed and actually fortunate to live through the evolution of endovascular stroke therapy, and truly first patients with thrombectomy or embolectomy that we treated were in the early 2000s, the initial trials. So basically we have variety of devices to do that thrombectomy that we talked about, and we physically all the endovascular stroke treatments are done interventionally from the groin. So we place the sheet in the groin, then we take the catheter and navigate under X-ray guidance all the way to the neck.
Wow.
And from that bigger catheter in the neck, we navigate the devices all the way to the MCA behind your eyeball and physically deploy those devices, recently stent retrievals or other thrombectomy device, to capture that clot and remove this thing back.
Wow. Are those treatments available at both Christ Medical Center and Lutheran?
That's correct.
Oh, wow.
And I have to tell you, the first time in the late 90s, early 2000s, when we're able physically, can you imagine? You have a clot, we have an embolus behind your eye in the brain, and you're there in the groin.
Right.
You know, he's playing with the joysticks and trying to maneuver everything, looking on the screen, trying to grab that. It was very exciting. But the first time I physically removed the clot in the middle of the night, we were just jumping up and down and opened the artery.
That is amazing. So let's move on to another area that's right in your line of expertise, brain aneurysms. One of the topics we said we would talk about today. Can you talk to me about what it is and what treatments teams like yourself and at these two hospitals are using to treat that?
Well, simply, brain aneurysm is an outpouching of the blood vessel.
Okay.
And you know, if you have a brain aneurysm, it's not what you ate. It's not really an infection that just happened. You're born with a weakness in the wall, and over the years, that bulge continues to grow.
Oh.
And as we mentioned, you know, small percentage of people may have some familiar genetic factors to predispose them to have brain aneurysm.
Okay, so can you clarify, because it's really kind of murky when it comes to the difference for most of us between a stroke and a brain aneurysm. Can you just say, this is a stroke, this is a brain aneurysm? What's the difference?
Well, in a brain aneurysm, stroke is a bleeding brain aneurysm.
Okay.
It's so-called subarachnoid hemorrhage.
Okay.
So every time you have a subarachnoid, you have that form of hemorrhagic stroke. So that's we have ischemic stroke when the arteries are blocked, and the treatments are totally different.
Okay.
And when the aneurysm rupture or you have a parenchymal brain hemorrhage, it's a form of hemorrhagic stroke. So having an aneurysm is not a stroke.
Okay.
When aneurysm rupture, it's a hemorrhagic stroke.
Oh, okay, I get it. So can a brain aneurysm then be kind of silent if you don't know it's there or that bulge is happening? I mean, do you experience, is a person likely to experience dizziness or anything to know that they're in trouble?
Well, and that's actually a very good question, because majority of brain aneurysm are completely silent.
Okay.
And people that have the ruptured aneurysm, they never really, most of them, they never knew ahead of the time that they had a brain aneurysm.
Okay, so not much you can do to determine if you are susceptible or that this is going on inside of your body?
This is all a good question, because we know statistically that per 100,000 of population, there's maybe 10 to 20 aneurysms. So to truly detect a brain aneurysm on everyone, you have to screen everyone with MRA, and I don't think we can afford it.
Okay. Okay, so I mean, it just treatment when it happens.
When it happens, but however, with the development of technology like MRI and CAT scanning, many times we see patients that present with regular headaches and get MRI. Many patients have other diseases of the brain, or tumors, or migraines, or TIA and stroke symptoms unrelated, and we discover those aneurysms more and more frequently as an incidental finding.
Okay.
So we see a lot of patients actually with brain aneurysms that haven't ruptured.
Okay.
And treating that population is a stroke prevention.
Okay. So this leads to a question that came in from Lucinda, who then wants to know, because you mentioned you have this bulge happening, may not be aware that it's happening in your body. Does that mean then a brain aneurysm can happen at any age?
Well, brain aneurysm, actually you have brain aneurysm throughout your life, most of them.
Wow, okay.
And the rupture may happen at any age.
Got
Usually the ruptured aneurysm present in the 40s and the 50s statistically.
Okay.
But they can happen. Children have brain, talking about strokes. Children also have brain aneurysms. It's a much smaller percentage, but they do. Then we have people in the 40s, 50s. We have people in the 80s and 90s that present with a ruptured brain aneurysm.
Wow. So since they're happening or occurring, is there some kind of physical activity that can increase your chance of it? Can you be in a car accident or like on a crazy ride or something and bump? I mean, is there anything that can, determine whether or not you're going to get this?
Well, you actually can have a ruptured aneurysms and cause an accident, and we have those patients. But if you have a brain aneurysm and you're going to bench press 300 pounds and you increase your blood pressure, it may increase the likelihood of that aneurysm rupturing. So if you have brain aneurysm and you don't know about it and you're hypertensive, you also, this is one of the risk factors that can increase the chance of having that. But if we're talking about category of berry brain aneurysms, activity will not increase your chance of having it at all.
All right. So you just kind of touched on this. Let's get back to, the prevention. You talked about, exercise routines, extraneous activity. What about, are there any things like decreasing smoking or anything like that that can help with the brain aneurysm?
Well, smoking is, it's a very good question.
Okay.
Because if we look, we already answered that question before. For ischemic stroke, we know that smoking increases atherosclerosis, chances of developing hardening and stroke. But we know right now that smoking in females are associated with higher incidence of brain aneurysms.
Okay. What about stress and stroke or brain aneurysm? I mean, stress can lead to so many different things. We know that. It's just not healthy what happens in your body when you're functioning at high levels of stress. Some people can handle stress very well, while others cannot. What about stress as it relates to these two, stroke and brain aneurysm?
I don't think the medicine in 21st century knows that answer. I don't think there's a correlation with brain aneurysm or stroke.
You don't. Okay, well, what about this? You said earlier when we first started that, your role as an interventional neuroradiologist is kind of like cardiologist for the brain. Now, we know when it comes to heart care, sometimes people put themselves on a daily aspirin, so forth, to help with their heart. Can you do that? Does taking a daily aspirin at all help with stroke?
Yes, a daily baby aspirin in your fifth or sixth decade of life and on is stroke prevention.
Okay.
I think we have to view stroke, ischemic stroke, all the cardiac disease, atherosclerotic disease, the coronary disease, and stroke, and well-being of your blood vessels anyway in your body. They're all connected. They're all blood vessels.
Okay.
They're in the different organs. So we have blood vessels in the brain, it's a stroke. You have a diseased blood vessel in a heart, is MI. So we have a diseased blood vessel in your leg, it's a cold leg. And but this is all cardiovascular system.
Okay, so Dr. Grobelny, we're getting ready to wrap soon. So tell us some of the key takeaways that you want those individuals who are watching us live right now, what do you want them to take away from our discussion today when it comes to stroke?
Well, I think that our audience learn about the two categories of the ischemic and hemorrhagic stroke.
Okay.
I want everyone to realize that stroke is a potentially treatable disease.
Okay.
And it's time is brain. So earlier you get to the physician, earlier you get to the emergency room when you're having a stroke, you're increasing your chance of better functional recovery. The other takeaway is an active stroke prevention, especially from the perspective of endovascular person or interventional neuroradiologist. If you have a medical problem like blockage in your carotids,
yes.
if you have a blockage in your arteries in your brain that cause symptoms, we can treat them minimally invasively to prevent a major stroke. If you know that you have a brain aneurysm because you had a headache that's completely unrelated and a sizable brain aneurysm, we can treat that brain aneurysm before it ruptures. It's
okay.
a stroke prevention. If you have vascular malformation in the brain, the same. So I think the big thing is with the current technologists, we're changing the face of stroke. And what's very exciting with an advocate right now,
yes.
because we're aligning all our hospitals together
Got
in
it.
a fight of stroke.
All right, that is amazing. And Advocate has 10 hospitals, so that is a big feat, and I know that you are helping to lead this effort. So the key takeaways here, remember that there are two categories of stroke, right? That it's a treatable disease, so you can survive and thrive following a stroke. That time is brain, so it's important to get treatment right away. Remember the things that you pointed out today about stroke prevention, so smoking, knowing your family history, the importance of that, and that there is great technology, and Advocate is at the forefront of having those treatments available. All right, is that a good wrap up, would you say?
That's correct.
All right, well then that wraps up this edition of Advocate Live. Thank you so much for watching us. Remember, you can text the word Advocate Live to 8444 to receive regular alerts about upcoming chats, and you can also connect with us anytime on our Facebook page or at advocatehealth.com. Thank you so much for watching us. Dr. Grobelny, thank you so much for joining us. Have a great remainder of the day.